All right. Is that coming up as a slideshow to everybody?
Mm-hmm.
I'm here. This is Jennifer.
Oh, hey, Jennifer.
Oops.
I can't see everybody, so Edward, I don't know if there's a way to make my screen so that I can see folks, but.
Yep, we're on it. I think you started the broadcast, so good morning, everybody.
Yeah, I did. I just, okay.
Yeah. Okay.
All right. So good morning, everybody. Thank you for joining this month's COVID call. I am McCrae Martino, Executive Director of the Community Foundation of Westmoreland County. And to start us off, as always, we want to highlight a piece of artwork from the Westmoreland Museum of Art. This one is called Bathers by Maurice Brazil Prendergast. It is an exceptional watercolor that contains the simplification of form, flat areas of vibrant color, and dynamic surface pattern that were Prendergast's hallmarks. In this painting, he captures the brightness of the coastal sunlight and the activity of figures moving through the idyllic scene in long, fluid strokes of color. Line becomes color, and the two combined result in a unified, harmonious whole. So thank you again to the museum for providing those for us on a monthly basis. And to start our call, I really only have one announcement for CFWC, and that is that we have our upcoming Westco Nonprofit Network event on June 25th at 9 a.m. And if you haven't had a chance to register for that, please do so. We will be focused on the human services study and looking forward to sharing the recommendations from the study and doing some breakout sessions around how we as a region can respond to the study. So Alyssa, is there anything you would like to add?
Good morning, everyone. Thanks, McCrae. Yes, we have been, as always, monitoring our 211 and continuing to see a lot of calls come in the month of May. We had 1,100 just phone calls, and then we have texts and chats and emails, etc. People asking for help, and it's a great lifeline for people. We are seeing most of the calls around food kind of steadying back to normal, what they had been pre-pandemic, and I'm sure Jennifer will talk a little bit more about what she's seeing at the food bank. Calls continue to be around housing, rental assistance. 211 is backing up the ERAP program, and I know Dan Carney, I believe, will be talking a little bit more about that, and that's for rent and for landlords. And then calls continue, of course, for utilities, in particular electric bills, people who are getting shut-off notices, people who can't pay their bills. We're able to provide some support for that. So continue to send people to 211 to help with all kinds of issues. What I'm hearing too is that there's a lot more calls coming in around mental health concerns for children, for teens, some social anxiety, going back out into the world, and then also what's to come after this. So I think we continue to see some of the after effects of the whole shutdowns, et cetera, and then the issues of coming forward as well. People looking to the future, some with hope and some with a little bit of trepidation, but I think that's kind of where we all are. Highest places in need in the Greensburg, City of Greensburg, New Kensington area, and Jeanette. Those calls continue to come in from those areas. So just wanted to make sure that everybody knows that, as always, 211 is available. If you are a provider and have some information, a new program, a change to the information that you're providing, a program need that you're seeing, please feel free to reach out to the 211 directly or to myself or anyone in our United Way Greensburg office. So thanks, and back to you, McCrae.
All right, thanks, Alyssa. Next up, we have Dr. Fox.
Good morning, everyone. It's good to see you again on this sunny day. Hopefully the sun will persist, although I'm not going to hold my breath on that. I'm happy to tell you that we have very low numbers of COVID positive patients in our hospitals, and we have a very low use of ventilators. So that's always great news. Looking at the month of June, we're only 10 days into it, but our positivity rate is 3.4%. So that represented 22 positives across our entire health system and only 15 individuals hospitalized in total during the month. And I'd like to contrast that for you with December of 2020. That was really one of our high points. And at that point, our positivity rate for the same 10-day period, the 1st through the 10th, was 41.9%. So at that point, almost one out of every 2 individuals who was tested was positive, and we had 973 individuals hospitalized during that same 10-day stretch of time. So a very significant difference. We still are offering monoclonal antibodies. Monoclonal antibodies are designed for individuals in the outpatient setting. We use them for folks at the highest risk of serious complications, and they are designed to prevent hospitalizations and deaths. So if individuals are listening and they have COVID-19, it is something that has to be given within 10 days of symptom onset, but please contact your physician and they can help arrange for you to receive this particular treatment. We also identify patients just based on our testing. So we make outbound calls as well. But if you were tested outside of our system, please, reach out to your primary care physician. Our Fry Farm Road site remains open for drive-through testing and for face-to-face evaluations. And of course, we continue to give vaccinations. We are doing that at the former Galaxy Fitness Center, in Norwood Medical Commons. We can offer vaccines to individuals over the age of 12. So we have both Pfizer and Moderna vaccines. And we are participating with Director Mertz and with Alyssa on homebound vaccinations. And that program is going really, really well. So if you have somebody who is homebound and needs to be vaccinated, please call 211 and we can arrange for that to happen. You can also reach out to Excella Health directly at www.excellahealth.org or call 724-689-1690. Currently, the vaccination rate for individuals over the age of 10 in the county is about 56% for people who have received at least one vaccine. So we'd really like to get that number up higher. So if you have individuals who are thinking about it, who have questions about it, ask that they reach out to their primary care physician or contact Excella Health, and we can arrange for them to be vaccinated. We're ready and we're waiting for you, and we'd love to have you. So that's it for me. Thank you.
Oh, thank you. What a difference a year makes, huh? So thank you for the good news. And moving on next, we have County Commissioner Doug Chu. And Commissioner, I will just jump into your slides. Does that work?
Sure, thank you.
Sure. There you go.
Well, good morning, everybody. It's always great to see everybody on these mornings. The first thing I wanted to mention is that our hospitality industry grants are going well, but June 15th is the last day to consider apps. And so there is some urgency if you know a restaurant, a hotel, or anybody else within the hospitality industry, there's some urgency in getting an application in. We are reevaluating applicants. If you received $20,000 already, but you still have more loss, we are reevaluating applicants for up to $40,000. That is occurring automatically. But there was still last week of almost $2 million left in that program, and I'm hoping we don't have to return any to the government. Alyssa had already mentioned that Dan Carney would be on this call, so I'll keep my comments on rental assistance brief. There is rental assistance. There's still over $20 million. We've only awarded a little bit less than $500,000. Unfortunately, this cannot help homeowners You have to be a renter, and it will help with rent and your utilities back to the start of the pandemic. The program is a little easier for applications than the programs in 2020, but you still have to provide some evidence and involve the landlord in order to get the applicant approved. Can you advance me, McCray, to slide 2?
Did that go? So the
Yes.
second one? Okay,
Yes, thank you.
sure.
Today, so this is, I guess, sort of breaking news. Today, we are going to vote at 10 o'clock on approving Westmoreland County to join the Commercial Property Assessed Clean Energy Program. This is based upon an act from a few years ago that allows counties to establish a loan program for private property owners. The program will allow private property owners to access long-term but low-interest financing for updating their energy systems. The funds are from the private sector, but the county is involved because the repayment is part of the property tax system. And so the long-term nature of the program travels with the property and isn't borne on the individual owner should they desire to retire or sell the property that they have. There is absolutely no cost to the county. And so we're hoping that some of the buildings and businesses in Westmoreland County will take advantage of this and that they will improve their electrical or gas infrastructure, bringing more efficient furnaces, more efficient HVAC, more efficient LED lighting into their facility and help improve their facility as well as use less energy going forward. We have relaxed the county, excuse me, we have relaxed the county COVID rules within the county buildings. And so if you were to come to the courthouse, you won't see any more signs for 6-foot distancing, and you won't see some of the signs asking you to wash your hands every few minutes, etc. We still are asking people to wear a mask and to do the other CDC required things, but you won't see the signage up in the courthouse anymore. The American Rescue Plan is in the news quite a bit. There has been very little discussion between my colleagues and I on the plan. We are getting in Westmoreland County about $107 million. We did receive the first payment. Treasury has still not posted final rules on how to utilize the money. The one thing that I can share is that all three of us seem to be enthusiastic about improving broadband across Westmoreland County. We are establishing a broadband task force. We decided that on Tuesday. And so hopefully we'll hear more next month about how we can improve and talk about broadband in the areas that we learned we need it. I think a lot of parents realize that it's challenging and that broadband maybe wasn't as fast as what they thought it was pre-pandemic. And so hopefully we can improve those things as we go forward. The next one on my list is county jobs. We have a number of jobs posted in the county for county work. And so hopefully if somebody's looking for a job, they will consider working for the county and putting in an application. The last time I was on here, I recommended that people check their voter registration to make sure their address is accurate. And so I wanted to follow up with a little story. There was a gentleman we learned of after the election who applied for a mail-in ballot and never received it. And whenever we pulled up his record, his mailing address was still a rural route. And I think most of us in Westmoreland County and Bud Mertz especially can say rural routes have not been used by the Postal Service in over 20 years. And so his ballot never went anywhere. It never got to him. And so I would continue to encourage our human service groups to help people check their voter registration so that there's fewer of these problems going forward. Lastly, I wanted to mention a little bit about the human service and mental health investment that Westmoreland County has done. The pandemic caused there to be fewer appointments over the last year, so there were some extra block grant funds in this area with mental health, behavioral health, human services. Many of these mental health and human service groups operate on such a tight budget that there is little room to improve their facilities, to improve their equipment, or other things. And I was really happy that we were able to take that extra money and get it approved to push back out to the community to some of these mental health providers to allow them to support building their program up. And so Excella Health had invested in some equipment for their mental health facility. A new facility in Irwin, Alapex, has invested some money in building their facility. Alyssa Cholodowski got some 211 funds because 211 has been so important during the pandemic, and they had to hire so many more people that we wanted to make sure we strongly supported that access for our community. And so I was really happy that we were able to reprogram those funds. I think the state has to increase some of the funds for these providers. The staff are being paid very low. There's a lot of staff turnover across the county with these providers, and hopefully if we can invest a little bit more in this, we can have a good program here in Westmoreland County. So that's the things that I thought were big since the last time we met. And thank you, McCray and the foundations for putting this on. And I look forward to continuing to see and work with everybody going forward.
All right, great. Thank you, Commissioner Chu. And I apologize to everybody, the slides were delayed. Luckily, Alyssa texted me to let me know we're having a little technical difficulties today. And so next up is Commissioner Sorelli Thrasher. Just a quick check. Alyssa, can you see the slide now that has the names? Okay.
Great. Thank you, guys. Good morning. Thank you again for having us on the call. I just want to say one thing after Commissioner Chu. He did say that we have removed all the signs in the courthouse, but we're still encouraging everyone to wash their hands. So even though the signs are down, that will always be encouraged. I know that's what Commissioner Chu meant, but just bringing a little bit of humor to the morning call. But thank you guys for everything that you're doing. I like just to follow up on everything that Dr. Fox said. In the last 24 hours, we've only had an increase of 3 positive COVID cases. So I remember back in December and January, I mean, it would be in the hundreds. So we have come a long way. We need to get that vaccination rate up though, because right now everyone that's fully vaccinated, for the most part, we're back to normal. However, if we can't get that vaccination rate up, I'm afraid that with the new variants and things coming in, that everyone's going to be punished from it, and we're going to take a big step backwards rather than forward. So please continue to push the vaccinations. Our percentage here in Westmoreland County is a lot low than what the state and what the national average is for vaccinations. But again, I just want to say thank you so much. Doug said everything perfectly of what's going on in the county. So thank you guys so much, and it's great to hear from everyone.
All right, thank you so much. Next up, Bud Mertz, Director of Public Safety.
Well, good morning, and thank you all for this continued partnership that we have here, because I think it's has worked out well over the last year. Just a couple things. First of all, as our numbers grow smaller, it's still not time to sit back, put our feet up on the desk, and say, "Okay, job done." I think the concerns that Commissioner Sorelli Thrasher had saying as far as the vaccination rate needs to be improved, and we here at Public Safety do not plan on really changing any of our tactics so that we still have a logistics plan in place in order to deliver any PPE that's needed. We still have, and with that being said, we still have the masks that from the human service side that was purchased that is still available as well. We continue to fill the orders for PPE, even though some of those regulations have laxed. There are a lot of our establishment and partners, including fire, police, and EMS, that need to wear them under certain conditions. So, our tactics are going to stay in place, and we're going to continue to monitor things going forward. But it also gives us an opportunity now that things are lightening up some, and people are going back to work. It gives us an opportunity to look at the relationships that we've built over this year, this expanded relationships and partnerships that we've had, and do more good with it. I mean, if anything good has happened out of this awful pandemic, I would have to say it's the relationships that we've made through there and the new ones that we've made. And we're in the process of capitalizing on them, so to speak, to make sure that we can continue to do good in the human service side with relationships. So more will be coming with that, but we're really looking at how we can better serve the public in times of disaster going forward. So we have that going. Going back to the vaccination rate, I do want to report, even though overall the numbers were low, the senior citizens 65 and older vaccination rate is at 83.9%. So that's a very good number pushing forward. We continue to work on the homebound initiative. We've gone through, in most cases, with a few exceptions of people that hasn't answered the phone or we couldn't get the appointments straight. We've basically gone through the first shot in a lot of them. And what we did was a midpoint, what we call hot wash in the emergency management field. You always have a system in place to analyze to make sure that you're doing things correctly, either in most cases that's after any disaster or anything like that, where you sit around and you say, okay, let's talk about the good things that happen out of this initiative or the bad things that happen out of this initiative. So public safety along with Excella Health held a hot wash with the EMS agencies last week, where we talked about the good and the bad and what can be improved as we go into the second round. And we came out with a few corrective actions that we are putting in place, and moving forward with that. So it's a good thing. Even though we went through the first round, we're still taking names for the homebound initiative. I've gotten one or two this week actually on my office phone. I know that 211 gets a few in here or there. So there still is the availability to get on the list and get the vaccination for the homebound folks that are out there the best way that we can. Talking to some of the ambulance services in the hot wash, it was really nice to see that, hear from them that that it really makes them feel good, because when they go into the house, usually they go in an ambulance, a paramedic will go in the house for bad reasons, but now they're walking in the house and they're giving these people that opportunity to not be as confined. To start seeing their family more and everything else. And they said it's rewarding for the paramedics. It's very rewarding because they're glad to see them, and they're glad to get the vaccination and trying to get back to that normalcy in their life as well. So it's a good thing moving forward. But again, you know, it's not over. And I think that we will continue to take names as long as there are arms to put them in and going forward. So I think that's about all I have for right now. But again, thank you, everybody, and for the partnership as we continue to move forward to do good things together.
Great. Thank you so much, Bud. Next up, Jennifer Miller from the Westmoreland County Food Bank.
Good morning, everyone. Thank you for having me on again. I really appreciate this forum and the information that we garner from it. The food bank is doing well, thank goodness. At the beginning of the pandemic, as I have told my staff throughout, we're going to be better because of this horrible year. You know, we learned different things. You know, we learned to work smarter, not harder. And it really has changed the way that we view things going forward. You know, our food pantries are so resilient, and they are still pre-packing boxes for the most part right in their facility, which has been a godsend for us. Getting volunteers here on a regular basis to pack 7,000 boxes a month, if not more, you know, I guess 21,000 boxes per month, really, you know, became a very difficult thing. And so they're doing that on their own so that they're still making it, you know, the distribution's low touch. We are, you know, operating our Fresh Express program now. It took a hiatus during 2020, needless to say, because it was not a low touch type of distribution, or was able to be a drive-through distribution for that matter, because of the areas in which we have those distributions. We have been able to modify how we do it, and it has become a grab and go type of distribution. Some places are going to be drive-throughs as we distribute, but some will continue to be, you know, have to get in line. Again, some of the distributions are held in alleys behind churches, and you just can't make that a drive-through distribution. But they are starting to pick up a little bit. People are getting the word's getting out that we're here, and you know, we've never left, but we're back with the Fresh Express distributions. The summer food service program will again be grab and go, and will begin on June 21st and run through the second week in August. So our sites went from 9 sites in 2020 to over 20 sites in 2021. So we are very, very pleased with the community's commitment to have these summer food sites, and they are so important to have right now more than ever. We know that a lot of the schools are participating in the summer food service program, and we are working right alongside of them to make sure that the word gets out, not only for the schools, but the community organizations as well. And one of the biggest ones that have opened new this year is at Kurt Nevin Arena. So we are really, really excited to have that Greensburg area be touched by the summer food service program. Needless to say, when the backpack program takes hiatus, then the summer food service program becomes even more important. So what we are hoping to do in the future is to have the backpack program run parallel with the summer food service program, and be able to give out backpacks on Fridays, because the summer food service program doesn't work over the weekends. But we're still working on that and the logistics to get that worked out. We do have a lot of slots available for our senior food box program. If you know of any seniors, if the communities that or the ambulance services are touching base with some of our senior residents that could possibly be in need of food that aren't able to get out to do so, please refer them to the food bank, and we would be able to get them a food box. We do provide limited deliveries, but we are expanding that program every day. So we would be able to work that out to accommodate that need. So there are a lot of things happening, you know, with unemployment being as it was, with the extra payment, SNAP being at maximum benefits, our numbers really hadn't skyrocketed, but we are starting to see them return to the normal rate. What our biggest concern is once all of that is back to normal, you know, and the stimuluses are not coming any longer, The SNAP rates are back to normal. The unemployment is back to normal. What is that going to do to our numbers? So we are concerned about the future, and we are planning for that as we go. So if you know of anybody that is in need of food, please let them know we are here. We are stronger than ever, and we're not going anywhere. So, but I thank you for all of your support, all of our community services organizations, the foundation. We would not have been able to get through this last year without all of you. So if you ever have any questions about the food bank services, please do not hesitate to call. And unfortunately, I'm not able to stay on the call. We are in the middle of our Feeding America audit. So I do need to step off, and I hope to see you all next month. And thank you so much.
All right. Thank you, Jennifer. Good luck with the audit.
Thank you.
You're welcome. All right. Alyssa, I believe, is going to provide an update from Feeding the Spirit. Deb is on the call. Unfortunately, with technical difficulties, she could hear us, but she cannot speak to us. So, Alyssa, I think you said you have some information from Deb.
Yes, thanks, McCray. Deb did just send me a text. Unfortunately, she can't have the audio, but that's okay. She says that Feeding the Spirit continues to average 200 meals per week, and that they are seeing an increase in calls for homeless placement and rental assistance. So I think that goes along with some of the other comments that we've had today. So thanks, Deb, for all of your great work with Feeding the Spirit.
All right. Thank you so much, Alyssa. And thank you, Deb. Dan Carney from Union Mission. Dan, are you on the call?
I'm here.
All right.
Appreciate the opportunity to share. As Alyssa and Commissioner Chu both alluded to, the Emergency Rental Assistance Program, ERAP, is kind of that hot button topic right now. We have distributed about $560,000 in relief out so far, and we have budgeted up to about $800,000. So the nice thing about this program is that in terms of helping stabilize housing, being that it can help for 12 months going backwards, it can also assist going forwards. And so we're finding a lot of households where we're able to pay for a few months forward for them and hopefully create some solvency for them and give them the opportunity to recover from that platform. So we do have paper applications available online and continue to try to push out. We'll be doing another major kind of marketing push out towards the end of June, just to push out, especially as we know the moratorium for evictions is going to end at the end of this month. I don't anticipate it being extended, given all the assistance that's out across the country for eviction prevention. The main kind of housing players that most people know, the Housing Authority, Welcome Home, Union Mission, Blackburn Center, Catholic Charities that are helping with those rent and utility kind of pieces, still are functioning and working hard. We're trying to qualify everybody we can for ERAP, since it has the largest amount of financial assistance available, and then using some of the other funded opportunities to supplant, where those funds maybe aren't enough or where folks aren't qualifying. So I continue to, ask you to refer those people to those agencies or through 211. 211 is helping to also do some pre-screening and kind of line them up to those resources. The shelter programs are still operational in our communities and still have the ability to help with overflow, isolation, quarantine if needed, all of those kind of things that are in place to help us out here. So we're going to keep going strong. We do anticipate a blip, an increase at the end of June going into July once the moratorium's lifted. So we're doing everything we can now to kind of abate that. So get those folks applications, have them call. We'll get them connected to the process. They can do it online as well. Our biggest challenge right now with the ERAP program actually is landlord participation and getting the landlord applications that we need. And it's so simple for them, but we're trying to do a lot more hand-holding to help them through that process. We have some landlords that don't want any tax liability. So they don't want to fill out a W-9 and have a 1099 issued at the end of the year. And so that creates some challenges for us. But we're going to keep plowing through and make it happen. So keep those referrals coming.
All right, great. Thank you so much, Dan. Appreciate it. So I just want to thank everybody, all the providers, public safety, the health system, everybody for all the work that you're doing around this. And it's been really exciting for me to be part of these calls and to sort of meet all of you and learn about everything that's going on. We have had a request from one of the participants in the calls in the past couple sessions to share some information about resources that individuals can share with clients they serve and the community at large. One of those was from the Private Industry Council. And so Michelle Keller, is it Michelle or Michael?
It's Michelle.
Okay, I wasn't sure because I've met, women named Mike. So Michelle is the Vice President of Education and Workforce Development at the Private Industry Council of Westmoreland Fayette. And she's going to share a little bit of information about their services. Michelle, I know you provided me with a lot of slides, but are not going to go through all of them. So just prompt me when you want me to shift.
Okay. I appreciate the opportunity for us to talk about a couple of other programs that we offer here at the Private Industry Council. Can't possibly go through all of them, but I did highlight 3 in the slides that either are new programs or ongoing programs. The one is our Youth Reentry Program. It is funded by the Westmoreland Fayette Workforce Investment Board, but we administrate the case management part and the mentor part of the program. The structure of the program is we assist young adults that are between the ages of 18 and 24 that have had some kind of dealing with the juvenile justice system as a juvenile. And they may need a little bit of extra assistance with a variety of things whenever they turn 18 or graduate from high school. So they can meet one-on-one with a mentor. And then the next slide, please. They can meet one-on-one with a mentor. We can meet with them via Zoom. We can meet with them in person. We can meet with them at their house, wherever it is most convenient for the young adult. We can assist with transportation if they need transportation to get to another program to register or to get to a job interview. We have some young adults now that are looking for housing and looking for places to rent and so on that we can help them with. We also provide them, I call it a menu of services that are offered in the county. This program is in Westmoreland and Fayette County, but I'll focus on Westmoreland here for the call today. But we can provide them with a list of other programs that they would qualify for that are going to give them support as well. The PA Career Link is also a program and place that we offer here at the Private Industry Council. So the young adult will have the opportunity to have those resources available to them while in our program. And if they don't feel that any other program meets their needs while they're with the mentor, then we'll do our best to provide that one-on-one with them. The next slide shows what incentives and stipends that we offer. So anytime that they meet with a mentor, they're going to get $25 per meeting, and they can do that up to 10 meetings. We have goals that they identify on a goal plan, and each time that they meet one of those goals, they will get $100 up to 2 goals. Since it is a new program, we have a pre-survey and a post-survey that the young adult takes that will give us a little bit of feedback, because we would like to continue this program beyond the grant period. And we thought the information that is on the surveys would help us do that. So we are giving them $50 for completing the 2 surveys. And because employment is one of the focuses, not only in the area, but with young adults in that age range, that if they maintain their employment for 60 days, we will give them an additional incentive. So you can see that that's, I believe it's, if you click next, I think it's $600 total that they can earn in the program. And this is money that is a stipend or incentive, so it is tax-free. just for doing things that they would normally do. So we do have some additional supports. We can be in conjunction with any other program that they're in. So if they are involved with maybe adult probation, or they're involved in mental health services, or they have another case manager elsewhere, we can still be supportive to them. They do have an opportunity to get $250 for what we call them as supportive services. So if they would need an interview outfit or a haircut, a uniform like steel-toed boots or non-skid shoes for a job that they're getting. We have driver's education here at the Private Industry Council through ETI that we can offer to them as well. So they get a lot of, services along with the program. And then whenever they exit our program, we'll offer 6 months follow-up to the young adult after they complete that mentor program. A referral is easy. They can just call the Private Industry Council. We have 2 reentry mentors. We have Holly and Sam, and they can be called or text if they're interested in the program, or they can also go to our website, which gives them a link that they can fill out an interest form. So if this is, Alyssa was talking about the calls with housing and food and work and so on, this would be an extra person to assist them if they did have some sort of dealing with juvenile, as a juvenile. The next program that I'm going to talk about is our Experience Works program. And I think that this program has been around a long, long time. It's often referred as the PIC Summer Youth Program, but we have this program year round now. So it's not just in the summer. It is funded by the Westmoreland Fayette Workforce Investment Board, and we work with young adults 16 to 24 in this program. And there's a lot of different ways that they can qualify to be in the program. It's just not income based. So most 16 to 18-year-olds that are in school qualify for the program. And if they are 18 to 24 and not in high school, or they're not in college or any other kind of post-secondary school, provided that they're not working full-time already, because we do verify their income, most of them do qualify for the program. So that's definitely a good thing. How does the program work? Once we determine eligibility, the young adults will meet one of our youth specialists, and they develop goals that they're going to work on and identify any barriers, because it's not easy just to go out and get a job. Sometimes there's transportation as a barrier. Sometimes there's housing as a barrier. We do have a lot of young adults that don't have permanent housing. They may be couch surfing or not have anywhere permanent to live. Well, obviously we're going to focus on that before we get them, into employment. The young adults will be paid $10 an hour, and it's up to 240 hours. So it's approximately 8 weeks if they work the full 30 hours during the week. But the program can be extended if they can't work the 30 hours and so on. The goal of the program is obviously to give the employer an opportunity to kind of try out that young adult with us paying, that first 240 hours. And then the goal is the young adult will be offered a position at that employer after. And that happens quite a lot, that the young adults get a job, that they have their work experience at. So some other benefits of the program, there is paid educational hours built into the program where we can pay them if they have a training that they need to complete or they need some soft skills. We do financial literacy classes, career pathway classes like resume writing, how to do a cover letter, how to interview, and they will get paid to do those classes as well. And then after they have completed the program, we follow up with them for 1 year after that. And the reason we follow them for a year is because sometimes they aren't liking the job that they're in, or some other barriers come up that we're able to work with that young adult to overcome those barriers within that 1 year follow-up. So the next slide is that you're a business owner and you would like to participate in this program as well. That's easy. We have a worksite agreement that we would send to you. We can also bring it out to you. We do need a copy of your liability insurance. And since PIC is paying the young adults wages for those 240 hours, they'll be on our workman's comp insurance. And we do require you to hang some employment posters because some of the young adults are under that 18. But we provide those posters for you and so on. So the next slide is how to sign up. If you are an employer or that young adult, or even a parent of the young adult, you can call us, or you can go to our website. And again, there's an interest form on there that if someone fills that out, we will give them a call after that. So the last program, and I apologize for going fast, but I want to value your time here. The last program we have had successfully for the past 5 years here at the Private Industry Council, the Dads Matter program. And we recently, in September of 2020, got the program extended for another 5 years. So we are very excited about this initiative. We do cover Westmoreland County, Fayette County, Washington County, and this year we're doing Beaver County. So although we are here in Westmoreland County, you may know some dads and so on in those other counties that would be interested. In the light of COVID, we have continued to, enroll and have the program. We have had some, barriers and some challenges, obviously, like everybody else has, but we have, successfully enrolled. We did 1,066 dads in the last 5-year period. And this next year, 5-year period, we hope to get at least 1,100 dads in the program. And that is across all of the counties. So it is a volunteer program. It's developed with input from the community partners, employers, early childhood education. And again, I jumped ahead, but it is 1,100 dads that we're looking to serve over the next 5 years. So a lot of people say, who's eligible? Is it income? Is it anything like that? No, you just have to be a dad. You don't even have to have biological children of your own. You can be in relationship with somebody, maybe they have children, or you have your grandfather and you've taken on the role of being a dad, or you're an uncle and you have your nieces and nephews on a regular basis and you're in that dad role, older siblings. So there are a lot of different ways, but that is really the only qualification that we have to be eligible. So that's a very easy program. I know sometimes people have to jump through, some hoops to be eligible for some of the programs that we have out here, but literally this one is just being a dad. So in the program, we do have stipend and gift card incentives for the dads to participate. We give them referrals to community services and supportive services. We do that case management piece. So they are assigned a case manager and they are assigned an instructor that does dads classes. And this is all about making the dad a better dad. We know we get some dads that come in that are already great dads, but we want to make them even better. We want to make them the best dads that they can be. So whatever we need to do in order to help them do that, we will do. It is a voluntary program. So if they come into the program and they decide that maybe it isn't for them, there's no consequence or anything like that. They would just voluntarily leave the program. We do give them a certification at the end, a certificate of completion. And we do offer, this is the great part, we do offer training and certification programs, which we pay for. One of the biggest ones that we've been doing is our partnership with Douglas Education Center, and we are offering them a free CDL schooling license to go along with the program. And so many dads have taken advantage of that. They're coming out with jobs making, $50,000, $60,000 while they're finishing their program and their license. So that's a pretty good deal there. So how to enroll? Again, call PIC. If you're not sure what program you want or what program you qualify, you can just tell them a little bit about yourself and they'll get you to the right person. We do have flyers and so on. This QR link, I believe it works right on your screen. So if you want to scan that, you can do that right from the screen. Right now we have a booth up at Westmoreland Mall. It's called a pop-up cart. So we have all of our program information in that booth. You should stop over. We have somebody there every day, not all day, every day, because the mall does have extended hours, but our information is there. You can call, again, the Private Industry Council. We have so many programs from birth until elderly. As long as you're, wanting to work and wanting to better yourself, this is the place to call. We can help you with just about anything. So I appreciate the time today. I know I went really, really fast through all of the slides. This last slide is a little bit about what we do overall at PIC. and some of the other services that we offer. And if anybody has any questions, I would be happy to answer them. You can either put them in the chat. My email is my name, mkeller@privateindustrycouncil.com. You can give me a call, throw me an email, or what have you, and I'd be happy to help you.
All right, great. Thank you so much, Michelle, for that great
Thank
information.
you.
Sure. So that is it for today's call. The last time we talked, we were going to do one on July 8th at 8 a.m. to keep them going. I believe we'll have to extend the, or Edward, I'm not sure if you're still on, if you were able to extend the calls. All right, well.
Hey, can you hear me?
Yeah, now I can, yeah.
Okay, I'm having horrible technical difficulties today. So I'm sorry, question again?
Oh yeah, we were going to extend the calls through the end of the year because I think folks continue to share good information. And so I wasn't sure if you were able to already do that.
Okay, I will double check. If you haven't seen extension, I'll go ahead and do that after the end of the year.
All right, great. Thank you so much. And thank you everybody for joining us. And Alyssa, thank you, of course.
One more thing, McCray,
Yeah.
I did get a text from Mandy Zalek at Community Action, and she just wanted to put out there that the Human Services meeting will be in person, yay, on Thursday the 24th at 10 a.m. At Twin Lakes. And then I also just want to say to Michelle, that was amazing. I had no idea you did all of those. I'd heard about some of the programs, but thank you so much for sharing that information. Just particularly that 18 to 24-year-old, they need that help, and we need to be able to provide those programs. So thank you for sharing all of that great information.
No, I appreciate the opportunity.
Yes, thank you, McCray.
All right, thank you everybody. Have a great sunny day while it lasts, and have a good weekend.
Hey, you too.
Thank you.
Bye-bye.
Bye.